Finally, health chiefs launch mass testing scheme, 1,000 households to get antibody tests to trace how far the killer disease has already spread, and 20,000 homes will get swab tests within days. Health chiefs have finally launched a mass coronavirus antibody testing study to trace how far the killer disease has already spread in Britain. 1,000 households will have their blood samples taken every month by a nurse or trained medic, the Department of Health last night announced. Antibodies are substances made by the immune system in response to an infection and can be picked up by a simple finger prick blood test. The announcement marks a step forward after months of the government dragging its feet on a program which scientists say is essential to ending lockdown because it's the only way of getting a true picture of the size of the outbreak. Antibody testing, which has been picked up on much larger scale in other countries, forms a vital part of the government's 5-pillar testing strategy, but officials have so far only managed 4,900 tests and just 51 were done yesterday. Who takes responsibility for antibody testing remains unclear, with parts being done by Public Health England and the new scheme falling to scientists at the University of Oxford working on behalf of the Department of Health. The UK's scheme is dwarfed by one being carried out in the Italian region of Lombardy, for example, where medics now plan to do 20,000 tests per day. A separate scheme in the US will involve 40,000 healthcare workers, while Andorra has ordered enough antibody kits to test its population twice. British officials have also begun a separate scheme to carry out regular swab tests on 25,000 people, who will be tested around 15 times a year to see whether they have the disease, so the government can keep track of its spread. Swab tests can only tell if someone is currently infected. They do not look for signs of past infection, like antibody tests. The Department of Health revealed up to 300,000 people are expected to take part in the swab testing scheme within the first year. Antibody testing, known as the "Have You Had It" test, is still a controversial subject in the UK, and authorities have been accused of blocking out commercial tests which could be done at home en masse because they don't think they're good enough. The scheme has been slow to get off the ground because of the government's insistence on high standards. The 98% accuracy demanded by the Medicines and Healthcare Products Regulatory Agency, MHRA, is higher than the majority of tests on the market and higher than the commercial test approved in the US. The new testing round will be done by scientists at the University of Oxford on behalf of the government. Professor Ian Jones, a virus expert at the University of Reading, said today, the newly announced tests should at last address the level of virus circulation in the community and, to a lesser extent, the level of past infections. The infectivity tests, the "Have You Got It" tests, are possible as a result of the scaled-up testing facilities now operating in the Lighthouse labs. The much lower number of antibody tests, the "Have You Had It" tests, reflect the fact that these tests are currently much less scalable, at least with an acceptable level of accuracy. Together they will give important data on how prevalent the infection is and has been. Where this has been done elsewhere, the level of infection has been 20 to 50 times higher than the known positives, and we must wait to see if this is also the case in the UK. The hope for antibody testing is that, when widespread, it can give a clearer, faster picture of the size of the country's outbreak. Currently, the numbers of people in hospital is the most accurate day-by-day measure, but this represents only a small proportion of patients and can be out of date because it may take a week or more for someone to end up in hospital. The Department of Health is funding the antibody and swab testing study, which will be done alongside the Office for National Statistics, ONS. As well as the separate study, Public Health England has been analysing blood tests for antibodies since the beginning of April. Officials said they were expanding the program during April so that we have the potential to test around 5,000 samples per week. But with just a week until May, figures show fewer than 5,000 samples, including just 51 yesterday, have been analysed at the Porton Down laboratory. Health Secretary Matt Hancock said, understanding more about the rate of COVID-19 infection in the general population, and the longer-term prevalence of antibodies, is a vital part of our ongoing response to this virus. This survey will help to track the current extent of transmission and infection in the UK, while also answering crucial questions about immunity as we continue to build up our understanding of this new virus. Together, these results will help us better understand the spread of the virus to date, predict the future trajectory and inform future action we take, including crucially the development of groundbreaking new tests and treatments.